my fingers to kind of just do some soft tissue movement around the border of the scapula. So this is like the rhomboids and the vertebral border. I'm going to get up here on the top, supraspinatus. I can kind of get here in the coracoid process for the anterior aspect of it, and then I can come down the lateral border and inferior angle. So this is beginning to loosen stuff up. I can use my thumbs to kind of come in here and get the deltoid muscle. I can go a little bit deeper, get kind of the humeral head. And then I'm going to put my hand on his scapula in the back, his hand on the, well, it's more like the chest. And then what I'm going to do is I'm going to, this hand back here is going like this. And this hand is like, so I'm just kind of raising his shoulder. Yeah. So this is going like this. Now, it's kind of hard to see. But you see I'm raising his shoulder, right? So that's what's happening.
He's rotating the scapula clockwise while he lifts the shoulder.
There you go.
Towards the
Both hands are going the same direction.
And then counterclockwise on the other
I think
side.
so.
Up and in.
We get confused about the
So,
clockwise, counterclockwise.
This is just soft tissue work. I'm hopefully that I got the right position in the notes about counterclockwise a lot, but that's a good description. So then the other one for the rhomboids, let me have you lay face down. Let me get some fresh paper. All right, so there's two ways to do the rhomboids. I'm going to put his hand behind his back. I can put my leg here, which kind of lifts up and supports his humerus. I palpate the vertebral border of his scapula. One way is I'm going to put my hand in at an angle like this, cover it with my other hand, and then just push in. Nice and release there. So this is just soft tissue work. You know, maybe you kind of get in here and get a little bit of a thrust if you want, but it's not really thrust oriented. The other way that you can treat this, I can grab the shoulder ball, put my hand in like this, and kind of just move it around. So I'm just, again, mobilizing the scapula. All right. So with scapular mobilization, this is in relationship to the medial superior angle. If that angle has gone medial, I want to make it go lateral. If that angle has gone lateral, I want to make it go medial. The way that you will be able to tell that is through observation and looking at the person's scapula. Well, in order to do this, they have to have their back exposed to you. So in the clinical scenario, they'd be, you know, for males it's easy, they just take their shirts off. For females it's not quite as easy. They can leave their bra on perhaps, so you can kind of see what's kind of going on. Or they just have a gown on, and it's just kind of open towards the rear, and just make sure it doesn't like fall off. But then you can see what's happening with the scapular position. So with the rhomboids, I'm on the same side. To work with scapular rotation, I'm on the opposite side. So I'm going to have his hand this way. Again, if a person has like frozen shoulder or something like that, they may not be able to do this because they can't get their hand back there. And so if he has gone, and the point of reference is the medial superior border. If he has gone medial, I want to make him go lateral, right? So if I grab him like this, reach around, grab his shoulder ball, put my hand on his shoulder, I am making it go lateral now. You all see that? So this is just stretchy stuff. Now if it has gone lateral, and you want it to make it go medial, I'm going to bring his hand around like that, use his distal humerus as a point of reference, put my hand on his scapula, and then use his his humerus as kind of as a lever. My hand is on his scapula, and then, as you can see, it is now going medial. All right? So that's it. So again, those are stretchy things